The internal residual project that is set to kick off on 19th of February and end in March 24th targets the resting and breeding places of the malaria-spreading mosquito, the Anopheles mosquito.
No, our target is female Anopheles mosquito, which mostly bites at night and rests on the wall before and after biting. So people could be bitten even during the day, but by mosquitoes which don't transmit it. Okay.
Results from the first phase of the project indicate impressive progress made in reduction of malaria in the targeted areas. The first phase saw a drastic reduction in malaria cases to about 30% from 44% in the past 5 years.
With a very effective program, effective in terms of two things. One, that the percentages of the houses that we were able to spray was 94% of our target. So that's very effective. Even more effective is in reducing the mosquito population, particularly going after the Anopheles mosquito that's resting indoors and biting and spreading the malaria. If you look at the research, it shows the Anopheles is what's spreading here in this area all around the lake. So our research and evaluation of that showed that we reduced the Anopheles population by 94%. So it was very, very effective.
This is the second time in 2 years we are doing this in Migori. Last year again, households were sprayed in Migori. The chemical lasts on the wall for about 9 months. That's why we are back again this year. Results have shown that mosquito density reduced tremendously after last year's spray exercise.
So 5 years down the line, as I'd said earlier, we were at a burden of 44% as a county when you were looking at the prevalence burden. But now I'm talking at 30%. But endemic county in general, lake endemic counties that are fighting malaria throughout the year, Migori is one of those counties, in endemic counties. We are about 8 counties, Moso, Nyanza and Western region. The burden is at 27%. So if you look at 44 in 2015 and we are in 2017, last year, I'm talking about last year data, at 30%. Isn't that a big difference?
It's a big difference, but the question is that how low? However, experts insist the project must be complemented by other mitigation strategies to effectively achieve the desired results.
In Migori and Homabay, indeed throughout the region, where we're seeking universal coverage of bed nets, so 1 net for every 2 people. That was behind the mass campaign, mass distribution throughout the region last year. With that, starting with that baseline, the idea is now targeting areas that have continuously high transmission throughout the year. And so that's where you're seeing here in Migori, also in Homabay, and as we expand. So the idea is research will show that the two together, the IRS plus the bed net, is the best protection. So as we visit households through our mobilization and spray, we leave them with a message that they should continue to sleep under their nets.
Malaria. So as a county, I would say the message is out there. The only thing that our community members need to do is to embrace the interventions that we have. Being one of the interventions that we are launching today, IRS, they may accept so that we get into their structures and spray the chemical into their walls. And the chemical is supposed to last between 6 to 9 months, whereby they're not supposed to wash the wall, they're not supposed to smear the wall, they're not supposed to paint or even plaster the walls. If they do that in conjunction, with other interventions that we have, and majorly that is use of LLIN, we shall fight malaria as a county.
The project implementers are looking at having the prevalence rates oscillate below the recommended 5%. Over 400,000 households in Migori and Homabay counties, with a population of about 2.2 million people, are expected to benefit from the project in the next 5 years. Achola Simon reporting for Channel 9 News from Migori County.